everyone. Thank you for having me again. I'm honored to speak about this important topic of, mental health and kind of give hopefully some overall of mental health and then supportive services as well as coping strategies and techniques. So I'm going to see if I can hopefully share my screen. Let's see. Can you see it? Yes. Okay, great.
Yes.
Let's see. I'm used to using Teams. So I'm like, let me get it on present mode. Here we go. All right. So I just prepared a few brief slides just to kind of go over some things. So psycho-oncology, kind of a combination of all the different supportive services that an oncology department can service. So I will just say, obviously I work at Atrium Health and I'm under the Levine Cancer Institute umbrella. So I'm not certain what all other institutes have, but most cancer institutes have some type of psycho-oncology department. So I would certainly encourage everyone to find out what theirs is. And if you need assistance in navigating that, I'm happy to help. So I wanted to touch base on depression and anxiety. I have a statistic here too that a third of lung cancer patients are affected by depression, and this was an Ohio State University survey. So certainly with all diseases, especially cancer, depression and anxiety are very prevalent. And certainly in a lot of my patients, and speaking with the providers, it's difficult sometimes to tell what's depression and what's related to cancer. So whether that's, insomnia, sleeping too much, appetite, obviously all of those things are affected by a cancer diagnosis, but certainly they can also be affected by depression or anxiety. It just presents differently in every individual. And I like this chart because it kind of talks about how depression and anxiety can overlap. So certainly a lot of my patients are coming to the Levine Cancer Institute for their first visit, and we have a questionnaire that they fill out. And so then that gets back to me and I contact them. And a lot of times it's our patients feeling anxious prior to kind of what the plan is. And then once a plan is set, they're feeling a little more relieved as to what the course of their treatment may or may not look like. So as a clinical social worker, I provide resources, I provide emotional support and counseling to our patients, their caregivers, family members. I'm just kind of that extra support person to help navigate what depression may look like, what anxiety may look like, advanced directives. So basically, social workers can pretty much do a lot of different things, which is what I love about this position. And then with that being said, for a holistic approach, depression and anxiety certainly can affect the whole body. So here we have, I wrote down some notes. We have healing touch here. So we have like Reiki, I always pronounce that wrong. We have acupuncture, we have music and art classes, we have nutritional classes, dietitians, we have yoga, as well as psychiatrists, psychologists, and then of course the licensed clinical social workers as more of a speaking emotional aspect. But I like this photo because it does talk a lot about yoga and meditation. And I know personally I've started doing a little more yoga and meditation, and as hard as it is to get your mindset in that position, it seems to at the end bring a little more clarity. I have one patient in particular, and he has been practicing yoga 2 to 3 times a week. And he's just let me know how difficult at times in the class it can be to calm his mind. But by the end of it, after he's done practicing, he feels a lot better. So I do encourage a lot of times, even walking outside. I know, Steve, you mentioned it was cold where you were. So I certainly know seasonal, which can play a role in a lot of different things in our emotions as well, but just being able to get outside. So I always encourage, getting active and being as active as you can with kind of how you feel at that moment. So ways to manage stress, spend time in nature, but also if you are religious or faith-based in any certain way, sometimes practicing your religion, meditating in addition to that if you're not religious. is always helpful. Yoga, spending time with family, friends, loved ones. Some of my patients rely on their coworkers that they're very close with if they're physically going to work every day and or having to accommodate their work schedule with their cancer treatment. They find that relying on those coworkers is helpful. Reading books, whether that's related to cancer or not, just reading a good fictional book or a non-fictional book, a history book, whatever kind of brings you a little bit of happiness and joy. Thinking positive, having that mindfulness and that hope is really important in this population. I mean, it's difficult sometimes to have the hope. I know with a lot of people that I've talked to, it's why is this happening? What is my next steps? What does my journey look like? But trying to find a little bit of that positivity sometimes can really help. And then this is a great slide, and I can also send out a handout of different social media apps that I recommend a lot of times, and the majority of them are free. Some people may know about these, but there's different apps like Headspace, Calm, Breathe. Another one is Insight Timer. So these are all free apps, and they offer different platforms. So the Insight Timer one is one me and my coworkers actually use. It's a meditation one. So these are excellent, and you can set them to different time lengths. You can set them to different like things that you want, like if it's before bed and you want one to help you sleep, or you want one to kind of rejuvenate you in the morning. They have different filters that you can set. So I always encourage those. I also encourage a lot of journaling, whether it's a prompted journal, handout, I provide those to my patients, or if it's just finding, a journal and writing down kind of what your journey is. I have one patient who's chronologically documented everything that's happened in her journey, which is helpful to her, but others it may not be. But I think journaling is certainly something that is helpful. And then as the pandemic has certainly not helped socialization and activities the last 2 years, but hopefully now as CDC guidelines and things are changing, getting out and about, especially with the summer months coming, certainly it might be easier to get together with loved ones outside, still wearing masks if that's something that you need to do, but just kind of being around others, because for 2 years it's been very hard for everyone to be around their loved ones, which certainly has played a huge role in depression and anxiety throughout the whole population. And then, of course, visualizing your happy spot. I know some people, if I meet with them in infusion, it's kind of channeling, okay, I'm at the beach, like beach is my happy spot, closing their eyes, visualizing that. I have one patient who brings photos and we'll look at the photo and kind of take herself back to that moment, or bring a photo of a family and visualize this is my why, this is why I keep going. I have my family, I have my friends, I have my faith, and kind of taking that as a standing point to get through whatever moment you are going through.